Hi, my name is Dr. Arjun Chandrashekar. I work as assistant professor in Kasturba Hospital, Manipal. So today I would like to tell regarding GBS. GBS is also known as Guillain-Barré Syndrome. It is a allergy towards your nervous system. It is a rare but neurological emergency that need to be treated immediately and recognized as soon as possible. So what exactly is Guillain-Barré syndrome? It is neurological syndrome where your immune system attacks the nervous system exactly. So how it happens? So it is basically following a triggering event. What exactly is the triggering event? It is infection, that is the most common triggering event. So mostly will be a respiratory infection or a diarrhea produced by a bacteria specifically called as Campylobacter jejuni, or any vaccinations, sometimes even surgeries can produce this syndrome. So it usually presents 1 to 3 weeks following a triggering event, which I had mentioned previously. So what is the manifestation of this syndrome? It will be a progressive neurological illness, means it progresses once it starts. How is the progression? It progresses over 1 to 4 weeks. So the maximum progression happens within 4 weeks. It will not progress beyond 4 weeks. How it will be manifested? Patient will come with lower limb weakness, exactly. Starts with the lower limb weakness. Weakness in the sense muscle weakness it will be, and it will starts in the legs. Then it will ascend to the upper limb, means hands. Then it will involve the face. Then it can involve even the swallowing muscles as well as respiratory muscles. Everyone will have a doubt what it will produce. So exactly it can even produce a complete paralysis of all 4 limbs as well as swallowing difficulty and respiratory arrest as well. So what are the other symptoms that can be seen with this syndrome? It can have tingling sensation in limbs, numbness, crampy pain, swallowing difficulty, sometimes heart rate variations, blood pressure fluctuations. These things can also be a manifestation of this syndrome. When people have to exactly come to a doctor means if you are having any of the symptom I had mentioned, like weakness of legs that starts with, that later progresses to the limbs, other limbs as well, including upper limbs and swallowing difficulty as well. So how the diagnosis of this syndrome is made? It is through mainly clinical examination by a medical professional, preferably neurologist. It is a clinical diagnosis ideally with some supportive evidence from nerve conduction studies as well as CSF study, which means we will take the fluid from the spinal cord and we will test for some certain parameters that can be a supporting evidence for this disease. For diagnosis, we need a proper clinical examination as well as some supportive evidence like nerve conduction study as well as the CSF study that I mentioned before. So later we will come to the treatment aspect. Treatment exactly, it requires an intensive treatment, in the sense early recognition is very important and early treatment will give significant improvement, faster improvement and hasten the recovery process as well. He or she, patient whoever presents with this syndrome, should ideally be treated in ICU based on certain parameters like I told, swallowing difficulty, any respiratory depression. These things are seen more means we have to admit him in ICU and then manage the same. His respiratory symptoms have to be managed, his cardiac symptoms also to be managed. Before the treatment modality, one thing I wanted to tell is whole body is controlled by nervous system, means neurons. The signals primarily comes from brain, then through the spinal cord to the outside nerves. Nerve supplies every aspect of your body, including muscles, including your skin, including your GI tract. It also supplies some amount of supply is there for heart as well as respiratory system. So what is my intention to tell is that if the nervous system is severely affected, it can affect even heart, it can even affect lung as well, respiratory system as well. So we should manage all these things because this can be life-threatening if cardiac and respiratory is not managed appropriately. So patient needs to be admitted in ICU if patient has any respiratory depression or heart rate variability noticed. The specific treatment modality are 2. That is, one is IVIG, which stands for intravenous immunoglobulin, and second one is plasma exchange. These are medical terms, but what exactly this does is this will remove, as I told, our immune system attacks our nervous system, means our body police, which is our immune system, is attacking our own nervous system, thinking that it is an enemy to the body. To control the immune system, we will give IVIG as well as either IVIG or plasma exchange. This will stop the further damage that is happening to nervous system because of this immune attack. So that is the mechanism of action of these two treatments. And the rest I told, that supportive management of respiratory and cardiac should be appropriately managed in a good setting. Regarding the recovery, significant recovery is seen in a case of GBS. So almost 80%, okay, nearly 80% people do recover to complete normal. 80% I meant, out of 10 patients affected, 8 will have 100% recovery, while 1.5 or 1 to 2 patient may have significant neurological deficit, means there may be some paralysis and motor weakness still persisting even after the treatment as well. So how many days it will take to recover? That will be a question to everyone. So it will be usually few weeks to months. It is not in a day, it is not in hours, it is not in days, it may take weeks to months. So the complete improvement can be seen by 1 year in most of the patients. Nearly 80% patients improve up to 100% by 1 year, and on 20% may still have some deficit as well. My sincere advice as well as request to everyone is, first, as a common man, we have to identify the symptoms what I have mentioned previously. So early recognition and early treatment is the key to the early improvement in this syndrome. Thank you.